Are you suffering from obesity? Yes, obesity is in rise like an epidemic in the whole wide world. According to WHO, 23% of our population is obese. I repeat, 23%, which means that 1 out of 4 individuals are obese.
How would you define obesity?
Obesity is defined as abnormal and excess accumulation of fat, which affects your health physically as well as mentally. Obesity initially was thought as a cosmetic thing, but the problem is much deeper rooted in our systems and involves every single system of our body, which includes cardiovascular system, respiratory system, central nervous system, musculoskeletal system, and gastrointestinal system. I'll share with you briefs of these systems and the problems associated with obesity. For example, in cardiovascular system, which comprises of heart and blood vessels, hypertension and heart rate is much more prevalent in obese individuals as compared to a person having a normal weight. In musculoskeletal system, the incidence of sciatica, the incidence of arthritis is higher as compared to a normal weight individuals. In gastrointestinal system, prevalence of gallstones, diabetes, fatty liver, all these problems are much higher in obese individuals as compared to normal ones. So the bottom line is, it's mother of many problems, and it's now labeled as a metabolic syndrome.
What is the classification of obesity?
So we classify individuals as overweight, class 1, class 2 and class 3 obesity. And BMI or body mass index is a tool to gauge the classes of obesity. As per international guidelines, a person having body mass index below 25 is considered normal individual, and from 25 to 30 are overweight individuals, and from 30 onwards start the classes of obesity. Class 1 is between 30 to 35, class 2 is between 35 and 40, and above 40 are labeled as class 3 obesity.
What is the treatment option of obesity?
Now the treatment is tailor-made with the class of obesity you fall in. And the treatment options are: number 1, diet and lifestyle modification. Number 2, there are certain medicines which are FDA approved. And last but not least, bariatric surgery, which is gold standard for patients falling in class 2 and class 3 obesity. Those individuals who are overweight or individuals falling in class 1 obesity are treated by dietary modifications, lifestyle modifications, and there are few medicines which, as I mentioned earlier, are approved by FDA to treat such individuals. Those individuals falling in class 2 obesity, along with the risks and diseases associated, are candidates of bariatric surgery, and all the individuals in class 3 obesity are candidates of bariatric surgery.
What is bariatric surgery?
Bariatric surgery refers to a group of procedures which are meant and designed to achieve a sustainable and significant weight loss. There are 2 sets of procedures basically. One are the restrictive procedures and other are the malabsorptive procedures. Sleeve gastrectomy is a restrictive procedure, a beautiful procedure, one of the commonest procedure still being performed worldwide to achieve sustainable and significant weight loss. Then bypass is more of a malabsorptive procedure, and in this procedure we reduce the size of the stomach and we bypass the contents of GI tract so that there is a malabsorption as far as nutrition is concerned.
Is that long-term treatment, one-time treatment, or come back?
Yes, these are very effective procedures which have got long-term effects and positive effects on your health, not only for weight loss, but also reverse all the comorbids associated with obesity.
Are there any side effects of this treatment?
Yes, all these bariatric surgeries are very effective treatments for sustainable weight loss. And as far as complications are concerned, yes, every single surgery that we do carries a calculated risk of anesthesia-related complications and surgery-related complications. When it comes to surgery-related complications, bleeding or leak or strictures, these are the complications associated with the bariatric surgery. But having said that, done in right hand, performed rightly, these carry less than 2% of the complications. So these are very effective and safe procedures which can change the whole dynamics of your life.
Please subscribe Surgical Process and Recovery.
We do sleeve gastrectomy and bypass here in Akbar Niazi Teaching Hospital through a multidisciplinary approach. The patient first is evaluated by anesthesia team. If the pre-operative evaluation is done and the person is fit to go for surgical intervention, they are then admitted, and the procedures that we offer are sleeve gastrectomy and bypasses. And both these procedures are performed laparoscopically. By laparoscopically, I mean that these procedures are done by putting small rents which are less than 5 millimeter, except for one which is more than 12 millimeter on your tummy, and we perform these procedures. And in routine, these patients are discharged on third or fourth post-operative.